안녕하세요. 라이언 아카데미 더스틴 원장입니다. 오늘은 좀 특별한 컨텐츠를 만들어 보려고 하는데요. 미국에 정말 다양한 종류의 의사가 있거든요. 요즘 들어서 9학년부터 시작해서 12학년 학생들이 메디컬 스쿨을 가는 데 있어서 너 무슨 전공을 좀 하고 싶니? 라고 하면 저는 메디컬 스쿨을 가고 싶어요. 저는 의사가 되고 싶어요. 이런 질문을 되게 많이 받게 되더라고요. 그래가지고 오늘은 정말 학생들한테 조금 도움이 되는 컨텐츠를 만들어 보려고 하는데요. 어떤 의사가 미국에서 어떻게 보면 가장 되기 쉬운지에 대한 컨텐츠를 한번 저희 라이언 아카데미의 저희 에밀리아 선생님하고 같이 한번 만들어 보도록 하겠습니다. 자, 그럼 본격적으로 한번 시작 한번 해보도록 하겠습니다.
On today's Lion Academics.
Hi, it's Amelia from Lion, and today we're going to be talking about how to actually become a doctor and the types of doctors that you could actually be. So, how to become a doctor? First, you have to be mindful starting from high school. When I say being mindful, meaning that choose your extracurriculars wisely and your curriculums that you are taking in high school, because all of these kind of list up towards what major you're going to apply as for a certain college, and you also have to think about what college you should be applying to, but we're going to get there. So first, in high school, you want to stick to all of those STEM majors. If you want to become a bio major towards college, then stick to all those bio clubs, biotechnology clubs, and all those like other activities, and make sure to take AP Bio class or HL Bio or IB Bio or anything like that. For your resume, you kind of want to stick towards having a really strong resume in STEM or the subject that you're choosing in. And usually it's really helpful if you're pre-med, you should choose your major kind of early in a way so that you could prepare to go into college with that certain really good major. For example, there's so many universities that are really strong with psychology, such as like the UCs if you want to be like a psychiatrist, or if you want to like stick to being a bio major, then there's other universities. So you want to research and apply to the university that has one of the strongest curriculums for your major. So now we're going to talk about undergraduate studies in college. First, every college, if you're not into like those combined bachelor's and MD programs, then if you're in regular four-year college, there is something called the Premed curriculum. Basically, this is like a set of courses that you do need to take in order to be accepted to a medical school in the future. And there are like requirements and certain courses that you need to take, such as bio or like organic chemistry and physics or something like that. It depends on the school. So make sure to like kind of research this before you apply to a university. And while you're in it, you really need to get good grades on these pre-med courses, because these are the ones that kind of med schools look for. You may be required to take a writing program or something else, and they look at that as well, but they mainly focus on your grades that are for pre-med, meaning all your STEM courses. So kind of be mindful of that and make sure to get good grades on all those subjects. During your undergraduate studies, you also have to prepare for the MCAT. And actually, so one advice I actually got as a pre-med student from a medical student at Tufts was that you should prepare your MCAT as soon as you get into college. That's literally what he said, and I was at first really shocked, but it kind of made sense, because you should be able to finish your MCAT by the end of junior year, at least. Not even at least, actually, that's the max. So you should be preparing right as you go into college for MCATs. And keep in mind that MCATs are really hard exams that a lot of STEM students struggle to take and get good grades on, and you need to get a specific high grade for this exam in order to be even considered for medical school, or the cut line may be a certain amount of score that you get in the MCAT. So now this is really important, meaning that you should also study MCAT while you're taking all those other college courses. It shouldn't be something that like you should only study during the summer or something. That you should always do it while you're in college. And this is kind of like self-studying. There's no one really there to help you about it. You can use online resources and textbooks and papers, but like at the end of the day, after solving all those things, like that's on you. Take your first MCAT and kind of manage your schedule. So you really have to be considerate about that. One other thing that I want to talk about while you're in undergraduate studies is research. And research is really, really important, because this is what makes your resume really strong besides the MCAT when you're applying to medical schools after your 4 years in college. And for research, you definitely want to do that you're interested in. So for example, there's many different fields in the medical field, right? And if you want to kind of become a psychiatrist, then you should be doing a lot of like psychology research. Or if you want to be a surgeon, you should stick to those biomedical researches that you can do in hospitals. You can also do extracurricular activities such as like shadowing and that's really important because it shows that you're actually interested in the medical field. And if you're wondering what shadowing is basically following around a doctor in a hospital and just like looking at what he's doing or how he takes care of his patients and just getting a sense of idea of what the doctor does. There's so many opportunities you can do this. Most people actually wait till sophomore year to go into big extracurriculars such as research or shadowing, but I suggest you kind of start as soon as you go in because there is a lot of process that you need to go through to even like shadow at a certain hospital these days. You need to even go through like different forms or get accepted by the hospital, and even same for research. There's a lot of steps that you need to go through, especially as an international student. That also might cause a little bit of a barrier. As soon as you get into college, there's several ways you can do this actually. You can email your professors and kind of ask, are there any opportunities for research? Or you could actually email certain doctors. You could easily just go into a hospital and find the emails of certain doctors there are, and you could be like, hey, I'm from this university, and talk your way into how you need to do research and how you want to, and write the email in a good way where like you are able to get a position in that certain research or shadowing. So that's one thing that I also want to talk about. So one other thing that you really should do in undergraduate studies is that you should really dedicate to your professor that you're really interested in that subject. So go to office hours, and later on, this can lead to a closer connection with your professor, and you'll be able to get a letter of recommendation. Since the professor actually knows that you put this much effort in and you're really interested in the subject, please go to office hours. And so he will write you a really good recommendation for future colleges or universities that you want to go into. Show your professor that you are one of the students that he can kind of remember, because there is a lot of students in like one classes. If you go to colleges, there's up to like 150 students in like one class, and the professor is not going to know your name. So when you ask for a letter of recommendation, then it's not going to be good since they don't know you. So make sure your professor knows you out of all those students. Kind of go to office hours, and that's how you get a good letter of recommendation. Now we're going to be kind of going into the subject of medical school. Medical school, you do a variety of subjects, and you study so many subjects such as like pathology, pharmacology, and anatomy, and it's where you can find your path towards what doctor you want to become. And so you do various of activities after your studies in medical school, which can be hard. Also, just make sure that you get really good grades because you're still in school. You can't kind of think this as like grad school where you're just done and you just have to work after. The hospital actually look at your grades from medical school, and it's really important. This is one of the hardest times that you're gonna be in school for. Like medical school is really hard, so you have to push through. And this is where some people actually drop out or continue working. This is where people kind of know that like, oh, I'm really into medicine or not. So next, residency. Residency can actually last from 3 to 7 years. So that kind of depends on where you're working or like how much experience you have. If you're unlucky, yes, it can be until 7 years. And there are residency exams basically that you need to pass. And so the way people have longer years of residency is because they fail the exam and they have to repeat it another year. So one thing you need to keep in mind about medical school is that you will study non-stop. Like there is no end in studying. Even if you're done with medical school, you will be studying until the end. Even if you are the head of surgery, you're still going to be holding seminars and things like that. So there's a long way to go, so keep that in mind. So when do doctors become specialized? Most doctors actually choose their path in the second year of medical school. This is where they've kind of known what kind of subjects they're more interested in and what not. Like some people kind of learn plastic surgery, then you're going to go that way. So you get to do a lot of different subjects in medical school that helps you like determine what kind of doctor you're going to become. Some people really like switch up to feel what it is to be a certain doctor, such as like OBGYN or something like that. If you're scared of that or not interested in, you could definitely go into another subject. So this is how doctors kind of choose what doctor they want to specialize in. And so more into how doctors actually know what they want to do is like in the first year of medical school, you actually go into clinical rotations. And this is where students shadow practitioners and residents and interact with patients. This is where residents interact with gynecology or internal medicine or general surgery or neurosurgery. Like there's so many things. So even for like my uncle, he's a general surgeon. When he was trying to specialize during medical school, went into one of those gynecology shadowing. So he kind of really was scared of seeing babies being born. So that's when you know that that's not the right subject for you. And so there's a lot of this going on during medical school. And clinical rotation also kind of shows the work balance of each specialization. So if you are a general surgeon, you can kind of see the life of that compared to a pediatrician where they just have a 9-to-5 job, where it's more simple and you have an off day. So you kind of get a feel of what you can do about that. And through this, you kind of get to know the competitiveness of each specialization, and as I said, time in hospital versus time in office. And you could also keep in mind of the length of residency, because there are certain specializations where the residency is really long, and there are certain ones where the residency is actually a bit more shorter than other specializations. So if you do not want to take the longer path, you can kind of choose the other one. Some people actually ask me about what specialization is less or more competitive. So we're going to be talking from less to most. First up is family medicine. Family medicine is kind of like, it is mainly where the doctor interacts with the families. It is mostly a doctor that you can call to come to your house. That is kind of what family medicine is. And it is a non-competitive job. It's your own business and you do not have constant surgeries or it's like simple work. If you have a cold, you can call a doctor and ask him to come to your house. This is more like a thing in America rather than like Korea. So that's a bit different. Second is psychiatry. I can kind of tell why this is one of the least competitive specializations, because when you think of mental health hospitals, you know, like scary things like that, a lot of people are actually afraid of those things, so it is less competitive. Basically, psychiatrists, what they do is help with people with mental health issues and treat, diagnose emotional and behavioral like disorders. They're kind of different compared to psychologists and therapists, where they help people with mental issues like bipolar disorder, like schizophrenia, these big disorders. They're kind of abuse disorders, so they're more serious in those ways. And psychiatrists, they do make a lot of money. That is one thing that I know, and you prescribe medicine to those patients, but definitely I can tell why this is like least competitive specialization. When you think mental health, you think of mental health asylums and things like that, so there's a little boundary towards that. Physical medicine and rehabilitation. This is kind of where physicians work to help patients with impairments or disabilities, unable to walk, or being in an accident where they injured their knee or something like that, so they have a hard time moving it after surgery. You can work as a physician in a rehabilitation like center in a hospital, which is where all the patients go after you get a knee surgery, a back surgery, like something that makes you unable to walk or function in your daily lives. And this is also kind of related to physical therapy and pain management. So if you're into that, definitely this is one of the subjects you could specialize in. Now it's pediatrics. If you don't like children, you should not go for this one. But if you do love children's, then this is definitely the one for you. Pediatrics is only focusing on children's exclusively, and it's more like general medicine, but for kids. You're specialized in basically everything. So if a kid is sick, you go to a pediatrician. And pediatrician helps the kid get better. You can prescribe medicine. There's so many ways a pediatrician work in. They can help with mental issues, behavioral health factors, or social health factors. They only see children up till the age of 18. When you're above the age of 18, you get sent to doctors more specialized in that specific area you're injured in or something like that. The next one is emergency medicine. Basically, emergency medicine is when surgeons or doctors treat patients in the emergency room. So that's exactly what it is. And this is when you have longer hours of being on work. So that's something you should keep in mind because you are in the hospital kind of all day. Next is internal medicine. This is where physicians kind of focus on adults and prevent, diagnose, treat diseases and conditions for adults. So yeah, this is kind of different than the pediatrician, which is only generalized for kids. Next is anesthesiology, and this is a surgeon that works with anesthesia. So they don't actually conduct the surgery or anything, but they manage the amount of anesthesia that's going into your body to help you literally be asleep while you're in surgery. And they keep track of your heart rate and what is going on, that everything is safe while you're under anesthesia. This is the most competitive specialization. Also, you make the most money, even compared to surgeons. You make actually more than a neurosurgeon with this specialization right now, so. What are the best pre-med schools? Now keep in mind, pre-med schools meaning that it's before you actually go into medical school, so don't get confused that these are the best medical schools. It's more like pre, so that it prepares you to get into a good medical school. Number one is Harvard University. So basically going to Harvard University as a pre-med student boosts all of your application and your grades compared to any other university, also due to the name of the school, Harvard. And Harvard pre-med applicants are actually known to have the highest rate of acceptance in future medical schools. Harvard pre-med students actually had a 93% acceptance rate to medical schools, which is huge because medical schools are not that easy to get into. So that is really strong. Next is Duke University. While Duke doesn't actually offer a specific pre-med path, it does provide all the classes a student needs to be a pre-med student and it prepares well enough for a student to go into medical school. The good thing about Duke is that it also offers advisors that help students actually prepare to get into medical school or as just like a pre-med student. So that's really good because there are a lot of schools without pre-med advisors. And between 70% to 80% of their students actually get into medical school, which is really big. So that is a huge percent. So next is University of Pennsylvania. This is the oldest medical school in the country. And if you think about the acceptance rate for medical school, UPenn has 82% of students who go into medical school. And that is actually nearly twice the amount of the average, which is 43%. And UPenn actually gives out pre-health specialized programs that can kind of like guide a student into certain medical fields. So yeah. Next, we're going to be talking about Washington University in St. Louis, known as WashU. WashU had a lot of successful applicants that got into med school between the year 2017 to 2021. And actually WashU gives out a two-part program that begins with lecture slides and detailing the educational pathway to getting into med school. So that's really helpful. So next is Rice University. Rice is actually in Houston, Texas, and between 30 to 40% of its incoming students are actually pre-med students. So they have a pretty big pre-med community. Rice is actually really close to the Texas Medical Center, which is the world's largest medical complex. So this basically gives students more opportunities to do research or clinical shadowing and just have connections to hospitals. So that's really helpful. Also, there is specialized advising in Rice University for pre-med students. So that is really also helpful as well. Number 6 is Stanford University. Stanford doesn't really have a pre-med major, but it gives students plenty of resources to become a strong applicant for medical schools. And Stanford actually helps students and assists them to picking out their classes and planning for long-term objectives for their summer and everything to make them a strong applicant for medical school. One thing about Stanford is that in autumn, the former assistant director of admission at Stanford University actually makes time to talk to Stanford pre-med students. He talks about the application process, the selection process, which is really helpful for students to keep in their notes when applying to medical school. So yeah. So next is Northwestern University. Northwestern is actually known to be sending students to one of the best medical schools. That includes Harvard, NYU, Columbia, Johns Hopkins, and UPenn. College actually provides health professions advising, which is basically advisors that help you out with your pre-med courses and like what to do with your extracurriculars and just give you advice throughout your whole journey in college. And this kind of leads to like a successful admissions process for future medical schools for the students. So yeah. Now it's Brown University. Surprisingly, Brown University has 80% acceptance rate of sending students into medical school. And Brown also offers healthcare advising, which is really helpful for students who are kind of struggling in what they have to do to get into medical school. And Brown is actually most notable for their 8-year program that actually combines undergraduate with medical school. So it's the combined program. It is basically a program where a student has an easy process to get into medical school. They're basically in medical school as soon as they get accepted to the whole program. So that is what it is. So next is Amherst College, and Amherst College is actually a liberal arts college, so it is kind of not like what you would expect to be one of the best pre-med schools. But the thing about liberal arts college is that it kind of like cares a lot about students and kind of helps the students get into their dream universities and basically supports the student a lot. Even if they have to take liberal arts courses throughout their whole journey, you may think that that might slow the student down in terms of like what they need to do to get into medical school. That's not actually true because the student can still be able to take like pre-med courses and everything while being in a liberal arts college. And this college is actually has a high percentage of sending students into medical school, where the percentage is from 75 to 80%, which is really high for a liberal arts college. So next is Case Western Reserve University. This university is actually known to have hospitals in walking distance within the campus, and meaning that it's like surrounded by medical fields and medical hospitals, and it gives easy access to healthcare professionals, which is really good, which is what exactly a student needs to get into med school. And Case Western still has a really high percentage of sending kids to medical schools, which is 62%, which is above average, which the average is 42%, so that is higher. And only 20 first-year applicants actually get into their combined bachelor's and MD program, which is where you're already basically in med school, as we already talked about. So these are the best medical schools that I've talked about, and I hope this whole video actually helped you choose your path and just have like a brief idea of like what your medical journey is going to be as a pre-med student. So thank you so much for watching, and I'll see you guys next time. Bye!
Coming up next on Lion Academy.
유펜에 지금 나와 있는 이 얼바인 홀 같은 경우는 어떻게 보면 되게 유펜에 되게 유명한 홀이긴 하거든요. 그래서 기존에는 유펜에서 인포메이션 세션을 해서 학생들에게 만약에 얘기할 때 되게 많은 학생이 방문하기 때문에 이 얼바인 홀에서 인포메이션 세션을 했었습니다.